First of all, from a bariatric perspective, the procedures that I offer my patients are the gastric band, the gastric sleeve, the gastric bypass, and revisional surgery.
I had the lap band done in 2008, and everything was going pretty good for maybe the first year and a half. In 2010 is when it got really, really bad, where I couldn't hold much food down.
When a patient comes to me with these complaints, I usually recommend that we go ahead and convert them to another operation. And the most common operation I will convert them to is either the gastric sleeve or the gastric bypass after the band has been removed.
Dr. Frenzel's commercial had popped up maybe a week or two prior, so I headed to the website, looked him up. He was available for an appointment right away.
One of the issues that could come up if you try to convert the patient from the band to the sleeve is you're exchanging one restrictive procedure for another restrictive procedure and not adding a whole other component of weight loss.
We discussed the various different procedures that could be performed, and we decided on a gastric bypass, and that's what he performed on me to remove the band.
The patients just need to be educated very thoroughly about the options. The gastric bypass, in my opinion, the weight loss is probably going to be a little bit quicker, and at the end of a year and at the end of 5 years, I think the results will still be better than the conversion to the gastric sleeve. The patients still have to do their part. No surgery is going to do 100%. They still have to do their 40 or 50% to help get the weight off, meaning they're going to have to eat healthy, they're going to have to see the nutritionist, they're going to have to come see me in follow-up, they're going to have to exercise. It's a whole spectrum of things that have to come together. It's like a puzzle. All the pieces have to come together to be successful. The surgery is one piece of that puzzle.
I just feel now that I'm ready to climb Mount Everest, run my first marathon. I know all of this is possible prior to this procedure that was performed on me. I was really just trying to exist. I know my family needed me, and I know I needed to work to maintain the things that you have to have in life.